frontline health workers who've had 2 COVID vaccinations will not have to self-isolate if they've been contacted by Test and Trace, so long as they test negative.
The opt-out for NHS staff is the first major concession from the government to demands for a major overhaul of Test and Trace, which, in just 1 week, saw more than 500,000 people pinged and forced to isolate. So is it time we brought forward self-isolation for the double-jabbed?
You know, I'm 82, and I do think it's time to be extremely careful.
It can be a difficult situation, and yeah, you'll get a ping off and say you have to self-isolate, but really, is that a problem if you're helping the country and you're helping other people?
If we're led to believe to have a relatively new vaccination into our system, then we should, in principle, be at much, much lower risk or no risk at all. So I don't believe we should have to isolate.
It's very easy to get about anyways. It's really a moral decision on the individual to self-isolate. So I don't think it should be required by law, but we probably should have self-isolate.
Well, joining us to discuss this, NHS palliative care doctor Rachel Clark and intensive care consultant Dr. Zudin Petercherry. Very good morning to you both. Right, Dr. Petercherry, today, frontline NHS and social care staff in England will be able to continue working in exceptional circumstances, even though they have been contacted and advised or told to self-isolate. Do you think that that is a good idea, considering the numbers of NHS and social care staff who have to be off because they might have had contact with a COVID positive case? At least it keeps the services running at closer to full capacity, doesn't it?
So that's a great question. I think we need to have a lot more detail before we can comment on this. The first duty we have is to make sure we don't put our patients at risk. And so we need to know that the staff who are coming in are not carrying or likely to transmit COVID-19 to our vulnerable patients. So we need to know what measures we're going to have in place to prevent that. The second thing we need to know is how are we going to protect staff? There are many, many staff who've died during the course of the first and second and third waves of the pandemics. And we need to ensure that those people coming in who are not self-isolating are not posing a risk to other staff. So those are the sort of questions that we need to know more details on. So I'll be fascinated to read those when we see them.
And Dr. Rachel Clark, the argument, there's a separate case, isn't there, when it comes to NHS and social care workers, and we know that the rules are going to change from today. But there's a broader argument about whether the August the 16th date, which will end self-isolation for those who have been double jabbed, should now be brought forward to today. I think there's a lot of people who wonder why restrictions are all lifting. You know, we can all go out and do our thing, but we still have to stick in self-isolation. You're a doctor, you're at the sharp end. You see the outcomes from these restrictions lifting, but you're in favour of that being brought forward, aren't you?
Not exactly, no, I'm not. I think if it were possible to do this whole thing completely differently, perhaps if doctors were more involved in helping make these decisions rather than the politicians deciding which ones should come first, then it could well be the case that a first unlocking measure that potentially had a lot of benefits without very much risk would have been to stop the requirement for self-isolation for people who had had a double vaccination. We can all understand the potential benefits of that. Economically, businesses can still function, people can go to work, and if you're double vaccinated, your risk of transmitting the virus to other people, if you've caught it, is much, much lower. So if we were in a different universe that was the furthest thing from today, where masks, social distancing, all of the measures that are protecting people from catching COVID have just been ripped up by this government. And if we were trying to figure out what is a good first measure, then I would say absolutely that could be a good first measure, because if you weigh up the risks and benefits, which is what every doctor does when we're deciding whether to proceed with a drug, an operation, then you can see there are positives and not many benefits. Whereas if you take masks, for instance, there are terrible downsides.
So, Dr. Clark, just to establish, that's a really interesting perspective. You would do away with the lifting of all the restrictions we've got on so-called Freedom Day, and you would introduce instead the exemption for those who are in contact but have been double jabbed. So it's a completely different priority than what the government has gone ahead with today.
Precisely, and I think if you look at this through a political lens as well as a medical lens, you have to ask yourself, why has the government gone for these eye-catching measures like doing away with masks rather than the more valuable potential measures in terms of lifting people, liberating them from self-isolation if they've had 2 vaccinations? And I have to say, I cannot understand the decision-making. There's no downside to wearing a mask, except it's a bit annoying. But if you wear a mask, you're potentially saving the life of a young child with cystic fibrosis, say. It's really baffling. And the other thing that is so frustrating is, if people knew that once they'd been double vaccinated, they would be exempt from self-isolation, it might just encourage more people to come forward and get their jabs. So at the moment, we're seeing people in their 20s in ICU potentially dying from COVID, and they could have been vaccinated, but figured, I'm young, it won't happen to me. And I can't tell you how heartbreaking that is.
Yeah.
If there was one thing I could say today on Freedom Day, and I won't use that term because it's insulting to so many people, I would say, if you're 18, 25, 32, and you think I'm invincible, the bad stuff's never going to happen to me, please, please get your vaccination. We don't want to see you in hospital. No. We want you to be healthy. We want you to live.
Absolutely. Dr. Petercherry, I wonder what you might say to our viewers that are getting in touch with us, and you will know better certainly than we are because you are frontline. All those people that have had their operations that aren't COVID-related delayed because of the situation. Our waiting lists have extended extraordinarily, exponentially because of what's been going on, and we need to get things back up and running, but people that are desperate for liver transplants, for cancer treatments, all being put on hold because of what's going on with COVID. If we can get those NHS workers back to work because they've been double jabbed, and we can do it carefully, and we can start helping some of these other patients that are desperately terrified of the situation they're in, which isn't actually COVID related, then that feels like it's got to be a good thing.
So the situation for many of our patients is awful. I agree, you know, we have I feel like a pandemic of chronic health problems, and our patients needing their cancer surgery, getting their hips and knees done, getting their transplants. We need this to happen for our patients. But putting in a simplistic thing like trying to get more workers back isn't going to help if we lift all the restrictions and we have another wave. In the last wave, we were ventilating patients who were my age. You know, I'm 47 now. They looked like me. They had children like me. They have family like me. Now we're beginning to ventilate people who could be my children.
That's
this
shocking.
Is where we are right now. And if we say we're going to simplistically lift all restrictions, we'll have Freedom Day with no plans and no infrastructure and no investment in the NHS, those people will still not get the help they need. Those hips, those knees, those cancer surgeries, the heart operations, they will still not happen if we have another wave.
With infections, Dr. Petercherry, with infections currently at 50,000 and the lifting of the restrictions today, what do you expect to see in 3 weeks' time?
So at the moment, infection rates have been doubling every 2 weeks. There were over 500 people in intensive care units throughout the United Kingdom. In 2 to 3 weeks' time, we would expect then, if the rates continue as they are now, to see more like 1,000. This may be more. This will then place greater strain on our services. Bringing people back into the NHS to work will perhaps alleviate some of this. But on the other side, if all those people end up working and looking after COVID patients, those operations will still be cancelled.
All right.
This is a major problem. You can't solve this by bringing a few NHS workers back if you then increase the number of cases by people not wearing masks and not social distancing.
All right, Dr. Petercherry, thank you very much indeed, and Dr. Rachel Clark.